Good afternoon. My name is Bobby Bohack, and I am here today to present this video based on remote collaboration and evidence-based care for NURS FPX 4030, making evidence-based decisions. According to the U.S. Census Bureau, as reported in an article by Harkey et al. In 2020, 59.5 million Americans, which equals 19.3% of the country's population, live in rural areas. The same article expands on the fact that discrepancies in healthcare exist in these rural populations and examines how telehealth can create a positive impact on the collaboration and provision of care for rural patients. The authors of the article define telehealth as the, quote, remote delivery of health-related services through telecommunication technology to clients for diagnosis, treatment, and prevention of disease and injuries, end quote. In this video, we will outline an evidence-based care plan for one such family whose toddler, Caitlin, was just diagnosed with cystic fibrosis and now faced the challenge of collaborating with her healthcare team remotely due to the distance they live from available services. Regarding Caitlin's diagnosis and family life. 2-year-old Caitlin has been admitted twice in the last 6-month period for pneumonia, had a meconium ileus or blockage in her intestine caused by overly thick meconium at birth, and also has decreased subcutaneous tissue in her extremities and weighs only 20.7 pounds. This indicates possible malabsorption of nutrients. Her mother reported to the staff that the child has a salty taste when she kisses her. Poor weight gain and frequent respiratory infections are signs that can point to a diagnosis of cystic fibrosis from DeBeck in 2020, which has been confirmed as the case with Caitlin. As patient outcomes have improved for sufferers of this genetic condition over the years, much of the improvement is due to the ability to receive intensive treatment with follow-up care provided by specialists, also from DeBeck in 2020. Providing this level of care will be challenging for Caitlin's team as the family lives an hour away. Properly educating Caitlin's parents regarding how to provide her daily therapeutic treatments and monitor for complications to better improve their ability to act fast when they occur will require follow-up through the use of telehealth options. This will prevent the long-distance commute for simple follow-up conferences with her specialist and the stress that the travel would place on the family and especially Caitlin. Following up through Skype conferences with Caitlin's care team will provide her parents the psychosocial reassurance they need as they learn to provide for her specific needs. Evidence-based practice model used in developing Caitlin's plan of care. A publication by Dr. Viendra in 2018 looks at several evidence-based practice models that can be put into action, with the Stettler model being the most similar to the methods Caitlin's care team is currently acting on. This model, quote, emphasizes the critical thinking process, end quote, and is described in the article by Viendra 2018 as having 5 phases. These phases include preparation and sourcing of evidence, validating the evidence, deciding if it can be applied, refining the implementation aspects, and evaluating the outcomes of these actions from Viendra in 2018. Caitlin's care team showed their ability to think critically, as this model advocates as part of the process, when they sought out help from her pediatrician, who is more local to her, the hospital social worker, and the use of Skype was included to provide real-time video interaction for follow-up visits with her mother. The actions they took through this critical thinking process also demonstrated that they were actively seeking, validating, refining, and implementing changes to improve the level of care they could provide from an hour away, much like the Stettler model depicts in the 5 phases. Putting this simple yet effective evidence-based practice model to work has given Caitlin's care team the ability to be an active part of her follow-up care, which, according to the article written by DeBeck in 2020, is an important part of improving the outcomes for cystic fibrosis patients. The most relevant and useful findings when making decisions regarding the care plan. An article published in 2020 by Harkey et al. Focused on systematically reviewing patient satisfaction levels with telemedicine services and found that there was an overall high level of satisfaction achieved. Keeping findings such as this study in mind when developing a plan of care for Caitlin and her family, which would involve the use of technology such as Skype to provide telehealth options, gives the team overseeing the child's care a viable means of supporting this family from a distance, thus saving time otherwise spent traveling, which is costly and hard on them. Utilizing telemedicine to support patients and their caregivers does not replace healthcare professionals, but instead creates additional accessibility for rural patients to services they need, from Harkey et al. In 2020. Benefits and strategies to mitigate the challenges of interdisciplinary collaboration. One of the strategies Caitlin's healthcare team employed to ensure she received the best care possible despite her family living an hour away was involving her entire team in the effort to create a sustainable and virtual setting for her care. This interdisciplinary method of agreeing to work virtually through Skype and other telehealth options posed the most benefit to ensuring Caitlin's family had the proper support while caring for their daughter from home. As the study conducted in 2020 by Harkey et al. Points out, quote, telehealth is a potential solution to address the need for rural populations, end quote. By including her pediatrician, respiratory therapist, and other key members of her team in coordinating how follow-up care was provided, they also took steps to ensure readmission would be less likely and Caitlin's overall outcomes would be improved, from DeBeck in 2020. In conclusion, the ability to apply evidence-based practice to the clinical setting is dependent on a familiarity with and willingness to follow the frameworks that evidence-based practice models, such as the Stetler model, provide healthcare staff. Using these tools to seek out research and formulate a plan to implement the evidence one finds can improve the quality of care that patients receive. It also gives the staff the tools required to evaluate and improve the methods they are using to deliver care. Finding solutions to issues, such as how to provide support for rural families that include current evidence, can lead to improved patient outcomes and better interdisciplinary collaboration among the members of patients' healthcare teams. Thank you.